This is TLV1.
The Tel Aviv Review.
Hello and welcome to the Tel Aviv Review. I'm your host, Huppert. Every week we bring you conversations with authors about the books and research and other things that we like. And if you like us, please consider becoming a Patreon supporter by going to our homepage, that's tlv1.fm/Tel Aviv Review. Scroll down to the bottom and click the big red button that says Patreon, click and support us. Some of you have been doing this for months and years, and we cannot thank you enough. This episode is part of a series in partnership with the Israel office of the Konrad Adenauer Foundation that was supposed to be called Israel Behind the Headlines. But the 7th of October events changed our plans, like everybody else's, and this episode is one of a few that will focus on the current crisis in its broader context. My guest today is a professor of psychology at the Hebrew University of Jerusalem. He's the director of the Laboratory for the Treatment and Study of Mental Health and Well-being there. Professor Jonathan Huppert, hello and welcome to the Tel Aviv Review.
Thank you very much.
So the 7th of October events have summoned trauma on an unprecedented scale, certainly in terms of the number of people affected, but in terms of the ghastliness of the actions unseen by Israelis since the Holocaust. Would people who have been exposed to brutality of this kind require a different treatment to what we've seen so far? I mean, until the 7th of October, would some of the methods have to be reinvented?
So I think it's a mix. There's, on the one hand, we have evidence-based treatments for post-trauma that are likely to be extremely helpful for the large majority of people who are suffering from what's gone on. But as in all good evidence-based treatments, there has to be adaptation for the context and for the situation, and for the individual as well. So it's not that we're starting from scratch in terms of that, but we're also, for sure, need to improvise and adapt to the current situation.
So give us a few examples of what it could be useful at this stage and what are the adaptations that needs to be made.
So at this stage, which is 3 months in, right, there are people on multiple levels of responses that they have had since the 7th, right? So one of the complicating factors is that we're not done with this traumatic event. We're still in the midst of it on many levels, right? The war is still going on. There are still hostages. And those two factors in and of themselves, in addition to, the international even background of everything going on, makes the context for what everyone is suffering from much more poignant and more difficult in many ways. This is not, when we talk about trauma in general, trauma has become a whole field in and of itself, trauma studies. And for sure, some of the origins of trauma studies go back to the Holocaust. So, and when we look at that event, for sure, that was an ongoing event for many years with horrors and atrocities that are unmatched for our own experiences, at least. There are also horrors and atrocities that occur in Africa and in Asia and all sorts of other places as well that are quite equivalent to what we've experienced in many ways, at least. But for sure, for the Jewish people and this national trauma that we experienced, on the one hand, like I just said, it's a national trauma on a level that's unprecedented in the fact that it happened in the Jewish state that is supposed to be the refuge for the Jewish people, particularly after the Holocaust, to prevent any kind of atrocity like this from happening again. And it succeeded until the 7th in doing so. And so there's a crisis. I think it's actually an international crisis, not just a local crisis, of what is the identity of the state and what happened to allow such a failure to occur. And there are questions. I don't think that the questions are necessarily answered negatively, but there are questions at least that arise about, is Israel truly the refuge for Jews around the world? And even more so, there are questions that Israelis have about what does it mean for our own safety.
So try to put it in like clinical psychological terms, this certainty, the stability that the state of Israel has provided so far was helpful in overcoming trauma from the Holocaust and perhaps in other instances, and the absence of, or perhaps the decrease of that certainty has created additional challenges to overcoming the trauma of the 7th of October.
For sure. I think on the one hand, I personally have heard stories from relatives as well as from friends of their parents and or grandparents, for example, who are Holocaust survivors, who have said that the highlight of their life is to see their grandchildren as soldiers in Israel. That it's just kind of symbolic of the turning of the tables from weakness and helplessness to strength and protection. And there was a failure on the 7th of that strength and protection. Again, I do think that many of us already 3 months out are saying, okay, it was a temporary failure. This is not, while it has major long-term implications, the state of Israel will survive and will rise, has risen already and will continue to rise to the occasion. But it has created a crisis in terms of, yes, being seen as this protector that has worked so well until now.
Mm-hmm. But also looking at it in the broader context, Israelis have been used to living under such ongoing emergencies. The Second Intifada comes to mind, and not to mention the residents of the Gaza envelope area themselves, who have been used to living under rocket fire, which is, of course, not the same scale as the invasion of the 7th of October, but, it is living in an emergency for more than 20 years. Does that contribute somehow to their mental resilience, and does it affect the treatment that they are supposed to get?
It's an interesting kind of mix that on the one hand, I think there's a level of resilience that Israeli society has given the multiple wars and operations and intifadas we've gone through, that ultimately we are not living in a neighborhood that's very friendly, and have experienced and had to have thick skin and had to really learn how to cope with trauma. The Intifada is an excellent example, and yet
also because it was ongoing, it lasted for a fair few years.
And yet at the same time, the magnitude, right, when you think about it, that there are more people died on the 7th than in all of the Intifada, right? I think, so the magnitude of one day versus the horrors of the Intifada, which we're still scarred today from, and then this kind of proverbial nuclear bomb of an attack on a single day versus this. So on the one hand, what you're asking, the constant low-level bombardment of terror makes you more resilient to it, and perhaps also more numb to it, not necessarily in a good way, that may have led to our enemies being able to take advantage of some of the ability to absorb such shots again and again. But yes, I think that there's also a system of, we know we need to get back up and keep functioning. The Intifada was an amazing example of how there would be a terrorist attack, and within a day, the store would be back opening and functioning with a little memorial of what happened already marking, but at the same time, going back to full business as usual as much as possible. It does feel different that way here, right? We had a full month of no business as usual whatsoever. And even now, there's a lot of ambivalence about going back to business as usual. There's a awareness of the need economically and socially to go back to business as usual. And at the same time, the mix of this ongoing war with our soldiers still falling and sacrificing left and right, and still in the shadows of the trauma of the 7th, still resonating with us in a way that makes it very hard to go just to pick up and keep going.
Maybe you can try to explain in layman's terms how trauma develops into post-trauma, and what can be done to counter that process, and why are some people more affected than others?
Right. So trauma is basically there's a whole academic debate about what is trauma, right? It ends up being a social political debate partially, as well as an intellectual debate. But actually there are multiple levels of implications of the definition of trauma. I'm not going to go too far into that, but just the way that we tend to think about trauma from the 7th, for example, is that there are those who were attacked on the 7th. There were the relatives of those who were attacked. And then there are various circles of exposure. There are relatives who received on their own telephones videos of their relatives being murdered. Now, after 9/11 in the States, there were a lot of debates about, could people in California have PTSD from watching the Twin Towers fall, for example? And there were estimates that people from all over the United States were experiencing post-traumatic symptoms after 9/11. Again, one of the parallels that people bring to the 7th and 9/11 in that way. But with the advent of the social media age, these things are even much closer to home. And with the close-knit society that Israel is, that 2 degrees of separation are far, right? 1 degree of separation is the rule. So everyone knows someone who lost someone who's a hostage, and so it is much more close-knit and therefore more impacted by the trauma in that way. So trauma is when there is some kind of threat to one's safety, or the more and more I think about it, actually the 7th has made me think about this a little more widely. An exposure to the evils of the world, I think, is actually a better way to think about how to define trauma than trying to define it as like a threat to one's physical or emotional well-being in some way. It's an exposure to the evils of the world when we, as human beings, I think, tend to like to try to view the goodness in the world. And that shock that it creates to the psychological system is what can then leads to all sorts of trauma reactions, including post-traumatic disorder or PTSD. So that already gives a little bit of who is more vulnerable and who's less vulnerable. Unfortunately, people who may have more pessimistic and tragic views of the world, on the one hand, may be less surprised by any kind of traumatic event. On the other hand, they're actually more vulnerable to developing post-trauma at the same time. So that sounds like a little bit of a contradiction. One way to think about it is, how much does your exposure to this evil change your worldview? And so someone who has a pessimistic worldview, and this really supports and even accentuates their negative view, they can easily fall into a real whirlpool of negativity, that the world is dangerous, that there's no one to be trusted, etc., in a way that it can become so disconnected from reality that it leads to distress and dysfunction, which are the 2 major criteria for a mental health disorder, in a way that can be very severe. On the other hand, also, it can burst someone's balloon in the way that they can start by thinking that the world is generally okay, and suddenly the world does not feel okay. So that's in general what I would say is happens when one is exposed to trauma. So what actually happens psychologically, mental health wise, is actually a common response. There are multiple common responses to trauma. There's not only one, but is to have intrusive images and memories of whatever the event was, to have a sense of numbness and also that forbearing that something bad is going to continue to occur, to have a lot of negative thoughts about the danger in the world, about perhaps also one's lack of efficacy, and perhaps even guilt and shame, not even perhaps, oftentimes, about one's lack of efficacy and lack of ability to somehow manage what happened, and hypervigilance about future events happening that will continue to threaten them or to be bad in some way. And those are actually the symptoms of PTSD, right? There's intrusive thoughts, there's avoidance, there's numbness, and there's negative thoughts and dysphoric types of feelings. So all of those happen to about 80 to 90% of people who have experienced a trauma, whether it be a car accident or, the 7th of October.
So an overwhelming majority.
But the rule is that over time, people naturally recover. People return to their baseline. The large majority of people, we don't know yet about the 7th, how long and how many and how long it will take people. And for sure, the hostages are much greater at risk at developing PTSD than someone who was in Tel Aviv or Jerusalem at the time of the event. But eventually, basically somewhere between, if I go really the wide numbers, 5 to about 30% of people will develop post-trauma, and probably more like 20 to 40% will develop some kind of anxiety, depression, or post-trauma to these events. So
just by virtue of that, we're talking about the magnitude of the event. It's unprecedented numbers,
for sure.
So what? I mean, you said that in terms of evidence-based research, there's something to work with in terms of the infrastructure of the treatment. Is there does Israel, in the most broader sense, have anything to work with?
So, yes and no. There are, especially in the Gaza envelope, there have been over the years what are called merkazei chosen, or resilience centers, that have been developed that are meant to help provide resilience to traumatic events, especially with all of the missiles and everything else that have gone on over the time. The immediate response to many people from the envelope right after is they didn't want to hear the word resilience, that they felt that I went and visited with some families from the OTEF over the weeks after. And one of the themes that came up very strongly was the feeling of being abandoned. And also that, like, what do you tell your kids? That these resilience centers had often told them to say, oh, don't worry, the army will protect us. And now what do you tell them? The army is protecting us still. Now, right, today, it's easier to say today when the army is strongly trying to change the picture in Gaza than the week or 2 weeks or 3 weeks after.
Yeah, but just like liars, they need to lie just once to be called liars.
Right. And so there's a crisis of trust and a crisis of feeling abandoned that is going to take a long time to recover, I think, in that way. So that's kind of infrastructure-wise. There is the Ministry of Health and there's the Ministry of Welfare, and they are trying to do things. But as you said, this is a crisis of proportions that nobody expected and nobody was ready for in many ways. There have been amazing grassroots attempts to organize volunteerism, including from the mental health professionals over the last 2 to 3 months have been really also unprecedented. People leaving their private practices to work with survivors on all sorts of levels in all sorts of places. But that's only a temporary type of response. One has to have an organized response from both local and national government in order to really.
But is it feasible? Can Israel really deal with the extent of the response that it needs to provide?
What does feasible mean? So, do we have the resources to do so? Do we have the knowledge to do so? Partially. Does the world have the knowledge, and are they willing to share that knowledge? Definitely. So, knowledge-wise, I think that we have a lot of important knowledge that I will try to articulate. That's definitely part of what we're here for, right? And for sure, we'll learn more as we go. And actually, in that way, I do think that Israel as a society loves to learn how to adapt. That's actually one of its, I think, magic aspects to it. Sometimes improvising too much, but I think on the other hand, they are able to adapt and will be able to take all of this knowledge and apply it. On the other hand, organizing and thinking long term are not the strongest strengths of Israeli culture and society in general, and that's where they're going to need to really pull together to be able to do that. The mental health system was in a crisis before the 7th, and for sure that crisis has been exacerbated tremendously due to what the 7th. But yes, there are already many initiatives. I'm part of some initiatives, but there are many beyond me in trying to organize and centralize resources in order to try to make sure that things will work well. And I have to say that the more I'm speaking to people, the more that people are, there are many people aware that there needs to be a centralized organizing system that will really monitor and supply services in order to maximize providing service to the scale that will be needed that is needed. It's not even will be, is currently needed and will continue to be needed for years to come. So I'm optimistic in that way that people from high tech, people from business management, from public health, and from all over are all trying to organize in order to try to make sure that there will be a coordinated system that will happen.
Yeah. No, I read that this tremendous grassroots response from volunteers could be counterproductive in the sense that, right after the 7th of October, there were countless number of professionals rushing to the Gaza envelope, looking to treat people with traumatic symptoms. And that it could be counterproductive in the sense that sometimes, as you say, in order to prevent it from developing into PTSD, the body, the mind needs some time to adapt and recover itself. And if you rush with treatment too soon, that might create damage. Do you see any evidence for that? How far-reaching is this phenomenon?
So it's a controversy within the field, and I think that there's a treatment called critical incident stress debriefing that has really fallen out of favor by most trauma specialists, which is to try to, on the day of the event, go find the survivors and organize them quickly to retell their story before they have a roof over their head, before they've contacted their family members. And that seems to not be helpful and possibly be harmful. Here we're talking about something a little bit different, though I have to say that in the first weeks, having gone to hotels, Yam HaMelech and other places, which were refugee camps, more or less, for the citizens of the Gaza envelope, and people are wandering around like zombies, there's this balance. I think it also exists in the army the same way. There's a lot more awareness of the need to do something about trauma, which is a good thing, right? So post-Holocaust, there was a wall of silence for almost 20 years after the Holocaust. Nobody would talk about it whatsoever. And even after the Yom Kippur War here and after the Lebanon War here, it was still dealing with trauma was not something that was explicit and on the table. And now every soldier unit that leaves Gaza has a mental health specialist unit that they talk to them about the different things and the needs in a way that is definitely beneficial and better than trying to just ignore the mental health issues that exist after trauma. So besides like really trying to on the same day, the more controversial issue is that we want to try to help prevent PTSD, and we're not very good at it. We can do all sorts of interventions.
We as
a profession.
Okay.
There have been multiple studies in different types of traumas trying to intervene within the first week. And one of the main problems is, it's a good problem that way, the problem of natural recovery, that people will recover without intervention. And so we're not that good at identifying who won't recover versus who will. If we were, then we could try to identify those who won't recover and try to do interventions to try to help them recover. And we are starting to be able to do that a bit. And it's a little bit circular, but what's one of the best predictors of who won't recover are the people who have responded worst to begin with. So the people who have the most severe post-traumatic symptoms right after the trauma are the most likely to continue to have post-traumatic symptoms a year out. There are other groups, right? There are some people who respond later and things like that. So what we know helps in terms of trauma recovery, there are really four main things. The first thing is helping people get a sense of control and mastery over their experiences. That means helping normalize their reactions, not pathologizing all of the traumatic experiences, including guilt, shame, and intrusive images, and the desire to avoid. And then avoidance is another piece. There are many treatments that focus a lot on helping people not avoid, confront those situations that they're afraid of. That means physically going back to places that are not dangerous and that are still memory triggers for the person. And that actually brings to the other part of avoidance, which is not avoiding the memory as well. It seems to be a highly effective, not always necessary, but often necessary part of treatment is to revisit the memory itself and to reprocess it, to retell the narrative. And some of that is really just re-engaging with the memory in a way that the metaphor that often is used is to take that dirty laundry and wash it and refold it and then to put it back. It's not that you throw out the laundry, but that you can actually at least organize it, fold it after it's washed, and keep it with you in a way that it's much more organized for you. And it does seem that the trauma narrative, telling it repeatedly, helps one tell a more organized narrative that does seem to be helpful for people. But the other piece is also it helps you make meaning out of the narrative, and the meaning that is originally created oftentimes is one that is more pathological, more negative, that I'm incompetent, that the world is unsafe, that I should have done something different. And when one revisits the narrative, they're able to revisit those aspects of it as well. So there's emotional processing that also needs to occur to feel the loss and sadness and fear, which oftentimes when one gets to those types of emotions, it helps you get through the shame and guilt that one feels that are really secondary emotions and not primary in response to the trauma. Large majority of people who feel the guilt and shame, those emotions are not reflective of reality. They're in that way. Guilt means that I violated some kind of moral or ethical code, and the large majority of people who have post-trauma and feel guilty did not violate any code whatsoever. And shame often is also a feeling like I violated my own moral code, or that I wasn't seen, or that I'm not seen. And to be able to re-experience things in a way that you see that you are seen and that you did not violate or do anything wrong, that you did the best you could given the situation and given your own natural responses, which include fight, flight, or freeze, right? Those are the natural fear responses to threat and trauma. And to be able to reframe and retell the narrative and remake meaning is a big part of what trauma treatment is about. And that is true for the seventh as it is true for a car accident or rape or anything else when it comes to that. And so in that way, we have a lot of knowledge on how to help people recover.
Has the 7th of October given you, as a researcher, as the head of a laboratory, any novel ideas or avenues for research, even the empirical base for unprecedented studies?
I'd like to say yes. And the truth is that we're getting there. But that my immediate response to the 7th was much less, how am I going to be research is a creative endeavor. And to me, my response on the 7th and after was much more, how do we use the knowledge we have and not how am I going to be creative here? And my hat as a clinician, more than as a researcher, was actually activated much more strongly. And for the first month or so after the 7th, I was really focused on how can we make sure we're doing what we do know, than much more than how do I research this. That was just my own personal response to this. My lab, we actually stopped all of the work that we were doing in our lab after the 7th. We studied pathological anxiety in general, and anxiety is so high in general that it's hard to know what's pathological and what's not. And we shifted to working on doing a couple of things. One is we're training a lot of people in treatments and trauma. That's an initiative more that I'm doing in collaboration with a number of others. And the other is we're working on developing an app that will help patients, therapists, and supervisors use technology, which is part of the research I've been doing over the years, to help make all of this information much more accessible. So there, we're going to study that for sure. And I do think that a lot of what's out there right now in terms of technology is based on 10 to 15-year-old technology. And our resources have really developed tremendously over the years. And so we're now working on trying to create the next generation of technological response to this. I'm in touch with some people about AI and that kind of thing. I'm a little hesitant to get too far there too fast. I think we need to be careful about using too much technology when it comes to that. But I think there's a lot of really important, useful technology in smartphones and on the web that we can improve tremendously, and also that we need to translate into Hebrew and ideally also into Arabic ultimately in order to make it accessible. This is not a startup endeavor. This is a social endeavor in order to help really society.
But it's interesting what you said about dropping the study on pathological anxieties, because pathological anxiety is so rampant at the moment. So what does it mean for us as a society? I mean, to live among, pathological is unhealthy levels of anxiety. What are the potential long-term implications of that?
So again, I actually said, and I think it's important, we're all experiencing high levels of anxiety. Is it pathological? Under normal circumstances, the levels of experience of anxiety that we're experiencing now would be considered pathological, but it all depends on context. And I think that it's not good in the long term to be living under such levels of anxiety and stress, for sure. And I hope that we will find a resolution to this conflict in a way that it's not a long-term status that we'll be feeling this way. It's also very unnatural. It's almost similar to the natural recovery from post-traumatic symptoms. As a society, we see, like Ukraine, for example, is working, their economy is returning during the war. We're starting to return in our economy. The intensity of the war that we had over the first 3 months is not going to be able to sustain itself in the home front in terms of people are starting to go back and with this kind of ambivalence about, but yes, stress levels are higher, and it means we're less productive. It means there's more conflicts in relationships. It means there is more anxiety and depression and mental health issues and substance abuse and conflicts in relationships. All of those things are elevated right now, for sure. As we saw also during COVID, this is, I think, it's like a hard parallel to bring. This feels much more intense than what was happening then. But at the time, when things were all shut down and everything else, it was pretty intense too. What are the long-term consequences? It does mean there's physical, mental health consequences, economic consequences. It's not good for society.
But essentially, it seems to me that mental health professionals really rely on a very fundamental faith in the resilience of people.
It's an interesting question. So I wish that that were the case, that mental health professionals did have a positive view of resilience, and some do and some don't. Various schools of psychology, some including, for example, Irving Yalom, in his existentialist school of thought, says that really the main goal of psychotherapy is to take away the obstacles to growth, that natural growth, that is what's natural. So resilience is the default in that way. But yet Freud and also acceptance and commitment therapy from a very different school of thought all say that suffering is the basis of existence, right? And so Freud had said that the goal of psychotherapy is to adjust to the misery of everyday life. So I guess that you could say that's resilience. So there are more tragic and more comedic views within psychotherapy about all of this. Or more pessimistic and optimistic views. So, but I do think that the data are that in general, people are resilient, and that the goal of therapy is to remove those obstacles that are impeding or interfering with natural recovery, and also to help boost flourishing and boost people to push themselves to grow beyond even their own natural abilities, but that a lot of the times, a lot of work is about removing obstacles.
Okay, Professor Jonathan Huppert, thank you very much for joining us today.
My pleasure.
And many thanks to Itai Shelem, the manager of TLV1 Studios, and to the Konrad Adenauer Foundation for their generous support. And now we've got a request, because many or most of you listen to us on the Apple Podcasts app, and would like to ask you to please consider writing us a review of any kind. You too can support us by going to our website and subscribing onto our Patreon campaign. Check out our archive. It has probably close to 1,000 interviews by now. Like us on Facebook, follow us on Twitter, and most important, join us again next week for another edition of the Tel Aviv Review. And until then, goodbye.